Yeah, just a quick review of the book, Treat Your Own Knee by Robin McKenzie. He wrote Treat Your Own Back Pain, probably his best-selling book. And from there, he actually wrote a couple other books, with the knee, the hip, and neck, that kind of thing. But anyway, real briefly, the book starts out by talking about how to diagnose your knee problem, which is accomplished by analyzing the pattern of your knee pain. Having said that, the book is basically for mechanical knee pain. That means like knee pain of mechanical origin. Maybe that didn't clear it up, but that's as opposed to something like, an infection in your knee or something inflammatory. Mechanical is kind of like nuts and bolts kind of thing, like arthritis would be mechanical origin. Anyway, then the book goes over some of the causes of mechanical knee pain, and then it goes over what to do about it. So the first thing is that I want you to improve your knee range of motion, your flexibility. And there are about 6 exercises to help you make your knee more flexible. If you don't get any response to that, then it's on to strengthening. There are a couple exercises they give you for strengthening. Basically, it's like mini squats, where you kind of squat down. One exercise, I think, is where you're on a step and you're just kind of squatting down. So that's how they're looking to improve your knee strength. Ending advice is basically watch your knee posture. What position are you putting your knee in throughout the day? I think that's sound advice. And increasing your activity. Because activity does help, move your knee joint, helps with lubrication, circulation, that kind of thing. And then finally, if none of these things work out for you, they recommend you see someone qualified in the McKenzie method. So yeah, that's really the main thrust of things. Basically, watch your knee positions, improve your knee range of motion and strength, strengthen your knee muscles. So that's basically the thrust of the book. I think it's a good place to start. I think sometimes your knee can have other issues that need to be addressed that are causing you pain, that you have problems with. So that's the approach of this book. That's as opposed to something like a book like this one, Bulletproof Your Knee by Jim Johnson, PT. Basically, this book's theory is pain is a result of something not functioning properly. So if you get it functioning properly, the pain goes away. So to that end, they're just worried. They don't really care really necessarily what your knee diagnosis is or what the problem is, because it's just worried about function. How does your knee work? Does it bend okay? Is it strong? Does it have good stability? So they have these. This is a little 10-minute program you do each day. Some days it's less than that. For instance, this is the Bulletproof Your Knee program. Step 1, keep your quads strong. This is a heavily researched book. Basically, it'll tell you like about any knee pain, any knee problem you can name. They'll probably show you a study that you have problems with your quadriceps muscle. So if you have like arthritis, you've had trauma, you have swelling in your knee, enough swelling in your knee kind of shuts down your quads. If you have any ligament tears, meniscus tears, it takes its toll on your quads. Your quads is the big muscle on the top of your thigh that provides most of the joint stability. So they're really big on quad strengthening. Fine-tune control over your knee. A lot of times knee problems occur because you have problems up at your hip. For instance, iliotibial band syndrome, is a mechanical, knee problem. It's actually caused by weak hip abductors. So it's going to cover all that issue with an exercise. Optimize knee flexibility, like the McKenzie book. It goes over how to make your knee more flexible. It just gives you 2 stretches and tells you some good evidence-based guidelines, so you don't need to spend all day stretching to get your knee more flexible. Also, your knee doesn't just bend and straighten like you think it does. About the last 15 degrees of straightening your leg out, it actually rotates a little bit. So this will help you get all those accessory motions back. Increase dynamic knee stability. Here again, let's take somebody like dynamic knee stability would be your knee proprioception. A lot of research coming out now showing that if you have a problem, a lot of people with knee problems have decreased proprioception. That's your position sense. So that'll give you an exercise for that. So here again, all about treating function. Pain is the result of something not working properly. Hey, if we get your knee more flexible, more stable, take care of any problems up at the hip, get the right muscles strong and stable, flexibility's 100%, your knee's probably going to be feeling pretty good. So that's basically the idea there. But anyway, if you did try Treat Your Own Back and you really liked it, by the same author, Treat Your Own Knee, good resource, great place to start. So check it out.